We're good to go. Good afternoon, everybody online. Good afternoon, colleagues. Good afternoon, friends. Welcome to the EMS Eco Session. I will start off by introducing the team here with me. We have the EMS Eco Secretariat. Of the names, Dr. Doreen Okrong Alalate. I'm an emergency medicine specialist. I'm also a clinical educator, and I'm the current president of the Emergency Care Association of Uganda. I'm going to be moderating this session. I'm going to be an expert on this session. I want to introduce my co-expert as well. So I'll let him introduce himself.
All right, thank you, Dr. Doreen. Yeah, good afternoon, colleagues. My name is Geoffrey Sekalembe. I work with SID Global Health and I'm the Monitoring, Evaluation and Learning Manager, supporting the MLE department. Thank you, Dr. Doreen.
Thank you, Geoffrey. Over to you, Angel.
Good afternoon, everyone. My name is Angel Maureen. I am an emergency and critical care nurse. I'm also a clinical epidemiologist and biostatistician, and I'm happy to be here today. Look forward to engaging with all of you today.
And behind the cameras, we have the team. They will not introduce themselves, but we want to appreciate them for all that they've been doing to make sure that you on the other end can be able to receive these videos, you can be able to hear us, and we can be able to interact with you. So this eco session is different from the rest that we've been doing. This eco session is focusing on shaping the future together. We want to reflect on past sessions. We want to reflect on the future. We want to reflect and see what we've been doing in regards to the eco sessions. We want to know what we can do better. We want to hear from you. But most importantly, we want to make sure that we're able to deliver and attend to your needs as the experts and you are the viewers. So it's going to be a very interactive session, and I'm hoping that we'll be able to interact. I want to make sure that everybody can hear us. So thumbs up if you can hear us. If you can hear us, just put your thumbs up. Let us know that you can hear us. Okay, excellent. Okay, good. So just to give us a brief on what we've been doing for the eco sessions, we all know that the eco sessions have been going on for about 5 years now, and that's a very huge milestone for us. We want to thank SID Global Health for the initiative. We want to thank the Ministry of Health. We want to thank the different partners that have been coming in to support these eco sessions. These eco sessions have been able to reach so many people across the country, but in different parts of East Africa and Africa as well. We've been able to target different cadres. We've targeted doctors, nurses, we've targeted pre-hospital care providers, from ambulance drivers to EMTs and paramedics on the ambulances. So all our pre-hospital care providers, hello to all of you. Thank you for taking part in the past 5 years of these eco sessions. All our teams in the in-hospital teams, the nurses, the doctors, the clinicians, thank you so much for being part of this eco journey with us. We've been able to cover a wide range of topics with you. We've covered disaster medicine, we've covered pre-hospital care, we've covered in-hospital care, we've covered pediatric emergencies, obstetric emergencies, adult emergencies, both medical and trauma. So we've covered a wide scope of topics. What can we do better now? It's now time to reflect. We want to have an interactive session with you, our viewers. We want to find out what can we do better moving forward. So before we dive into the interactive session, I am going to ask Geoffrey, who is our M&E specialist, and he's going to give us a bit of statistics and numbers so that you, the viewers, can also have an idea of what has been happening. So Geoffrey, over to you. It's going to be an interactive session. let him project his slides and we take it on from there.
All right. Yeah, thank you, Dr. Doreen. I'm going to take you through our milestones for over the last 5 years, from 2021 to date. So ideally up to the month of March 2026. So as per our topic, our session today, shaping the future together, and I'm going to be sharing our milestones from the EMS Eco session. So of course, our sessions, they mainly focus on maternal newborn child health and emergency medicine at a larger extent. So we mainly do support our sessions and are broken down through MNCH and emergency medicine. So as said, we have a strategy, and this organization strategy is started 2024 up to 2030. So within this strategy, we have a strategic outcome that is meant to strengthen capacity of 27,000 health workers to ensure that they're able to provide quality RMNCH and emergency care services by 2030. So through this, we have a number of approaches that we have rolled out. We have the EMS Eco sessions, which we are discussing today, and this happens bi-weekly. So a number of colleagues have been attending these sessions over the last 5 years. These have always been happening bi-weekly. Then we also have clinical pathological case sessions that do happen once a year, once a month. So these ones are mainly targeting pre-service health workers. Then we have the perinatal and neonatal training sessions that also happen once a month. So ideally, you can see that throughout the entire month, we have at least a virtual training session that is happening, at least weekly. Then, of course, we also do provide some capacity building at different seat-supported facilities. We do provide in neonatal service trainings to in-service health workers, and also supported the Ebola training response that we conducted last year. So this was the one-off, and these have been broken down into virtual and physical. So over the last 5 years, we have conducted a total of 113 sessions. Of these 113, we have data for 105 sessions. So ideally, we are missing data for 8 sessions, and this was the first stages of this rollout. So of these 105 sessions, you can see how we have been progressing. Of course, in 2021, we conducted our very first session, which happened on 3rd December 2021. Then we progressed to 2022, where we conducted 21 sessions. 2023, we conducted 25. We moved to 2024, where we conducted 23 sessions. 2025, we conducted 30 sessions. And so far this year, we have conducted 5 sessions. And in this graph here, you can see the trend of the different health workers that have been trained. These are unique in the sense that regardless of the number of times somebody is attending the sessions, we always do count this person once. How we identify this, we always very intentional to use the emails of the participants that are attending these trainings. So ideally, I would request all the different people that are always attending these trainings to ensure that you log in with your email and consistently be attending with the same email, because we always also do track the number of times a participant has been able to attend our sessions, as we are going to be seeing the different slides for going forward. So as you can see in this graph here, that we are increasing, our reach is increasing over years. From 168 for our very first session that we conducted in 2021 to 2,673. Then in 2025, we reached out to 7,903 unique health workers. And so far this year, 2026, we have trained 2,692. So from this, I will also proceed to this next graph here to show us our trend still, but also comparing with the new health workers that have been reached out or that are attending our trainings. We started, of course, with 168. In the year 2022, we reached out to 2,575 new. So ideally, these 2,575 did not attend the very first session. So ideally, our cumulative number here reached 2,743. So from this, In the following year, 2023, we again reached 2,525, again new. So these ones had not attended any of our sessions in the previous year. So cumulatively, we're at 5,226 by end of 2023. Then in 2024, we again had 2,248 that were still new attendants that had not attended any of our sessions before. So cumulatively, by end of 2024, we are at 7,516. So as of now, 2026, we are at 14,770 unique health workers that have so far been trained. As you can see, the two trends here. And I don't know if I can proceed, Doctor. So in the next slide here, we are able to see the average attendances in the different eco sessions. Of course, you can see that, of course, the first session, which was in 2021, our average attendance was just 168 because it was just one session. But you can see that over time, with the increasing number of eco sessions, also our average attendance is increasing. As you can see in this summary here, that we started from 168, the following year, 2022, we are 244, then we increased to 342, an average of 349 in 2020, in 2024, then 566, and as of 2026 so far, we are having an average attendance of 764, as you can see from this graph here, and it can ideally show that there has been a consistent increase in the average attendance for every eco session that have been conducted over the last 5 years. Then we are also able, as we do this analytics, we're also able to track the professions, the different professions or cadres of the people that are attending our eco sessions. And you can see that over the last 5 years, I've been able to select those high cadres that are always attending these sessions, the high frequency cadres. And you can see we have clinical officers, we have medical interns, we have medical officers, we have midwives, nurses, we have pre-hospital as well. Then we also have specialists and consultants as well as students. So you can see over the last 5 years still, there has been a consistent attendance by the different cadres. Of course, largely by the medical officers that are taking 33% of the overall attendance, then followed by the nurses, 28%. Then we have clinical officers at 13%, but also to appreciate that we have a good attendance from pre-hospital, which has a total of 212, and these are all pre-hospital. Then also have interns that are close to 352 that have been attending these eco sessions over the last 5 years. But mainly to appreciate that we have a very good attendance from medical officers, contributing 33%, a total of close to 2,468. And these are unique health workers or medical officers that have been attending. So if we try also to analyze this by facility level, we are saying that, of course, we have been having some bit of challenges because some colleagues do not always fully complete this registration form. Of course, it has been improved over time to ensure that at least as we register, before you can successfully register, all the information that is required for that form is now being captured, and then our quality of data is now improving. So we are now being able at least to use a denominator of 11,365, and from this, you can see that predominantly our eco sessions, participants from our sessions are coming from general hospitals, are taking a quota, which is 25%. But then we also have a good attendance from regional referral hospitals, 20%, close to 2,216. Then we also have national regional referral hospitals, which is also 12%. But we have a good attendance still from health center 2s, center 3s, center 4s, and private clinic, which is 15%, a total of 1,709, all from private clinics. So from that background, I also want to share this. We have been able to populate the most and least attended eco sessions. Okay. I think, let me first stop here for now. Maybe we can have insights for this few slides that I have presented, then later we can proceed. Yeah, back to you, Dr. Doreen.
Thank you, Geoffrey. Colleagues online, you have seen the numbers. I wonder where some of you lie. We've trained over 14,000 health workers over the last 5 years. We have the highest attendance being medical officers and nurses and midwives. So well done to the medical officers and the nurses that have been attending these echo sessions. Thank you for being consistent. We've also had high attendance from general hospitals, the private facilities as well, and the regional referral hospitals. So I want to ask members online, based off the numbers you've seen and based off the demographics of where the hospitals lie, I want to get feedback from you, members online. How do you think we can reach out to other cadres, especially the specialists who have the lowest attendance, the interns as well, but also we seem to have a low attendance from students. So from your own background and in your facilities where you're working, I'm sure some of you are interacting with some of these cadres. What suggestions do you have on how we, the ECHO team, can make sure that we bring on some of these members on board in order to increase their attendance? The specialists, the students, and the intern doctors. Please put in the chat. Please put in the chat so that we can hear your comments. Angel is going to be handling the chat, so she'll be able to see your comments. If anyone has a hand up, anyone wants to say anything, please put your hand up. Jackson, please unmute. Let's hear from you.
Good afternoon, Echo.
And what cadre?
Thank you. Good afternoon, Echo. This is Jackson Gutagwa. I'm a nursing officer, and I work with a regional referral hospital with the UPDF. I want to send in my submissions. It is goodwill that we think every other person can really attend the ECHO sessions. That's a good thought. But the cadre of specialists, we know how specialists work. I'm sorry I came in late. I don't know whether the moderator is also a specialist. But we've had specialists often a time jump from one hospital to another, one hospital to another. The time of their schedule is really small. The easiest way to have them is through inviting them to moderate sessions. That's how we can have them. But it's unlikely that they're going to be participants like we are. The medical field has a hierarchy. We tend to feel that when we come for such sessions, we are learning from the specialists. So for any other person that joins such a core, they feel like they are not learning from any other person. They feel like they're up in the pyramid, and they can only share with colleagues. Then for students, I think we shouldn't aim so much for students, because this session happens between the hour of 2 to 4 or 5. And you realize that such times for people in public universities and maybe other health training institutions, they're also having classes, because this is a weekly day. And it's unlikely that if we push it over the weekend, we shall also have them. And then the learning is also progressive. Sometimes you may flag off a topic which students also think will be handled in class. Let's say if we are dealing with shock, so maybe they feel like their lecturer is going to teach about shock, and maybe they don't have to come this side. So it's just a humble request that can we focus on the people already in the field, maybe the private health institutions. I see the attendance is a little low, but it is also encouraging that they actually attend a national session. So I think our focus should be how do we bring people that are not in mainstream government facilities into the ECHO session, and how do we bring in more people from government facilities to attend. But for specialists and students, I have reservations with them. Thank you.
Thank you, Jackson. Anyone who wants to say something? please put your hand up on how we can bring in the different cadres on board. We have a high attendance from the medical officers and the nurses, but we have low attendance from interns, students, and specialists. So we have some comments as well. Maybe Angel can read for us the comments.
So Alan Mujeni says the session happens during working hours, which are usually quite busy. I think we can push the sessions to 7 p.m. and above. Sometimes I as well find it very hard to attend because of the work. Judge William mentions that many medical officers attend, among other reasons, because of the strong requirement for CPD points to renew their licenses. So cadres without this incentive are bound to attend less. Felix Murangira says, according to the trend, so far not so bad, but my submission, some of the medical personnel may be busy, and since the session takes place during working hours, it could as well be a hindrance.
Okay. Thank you for your comments. We are taking note of these. Again, this session is meant to improve our eco sessions. We are reflecting on what we've been doing and we want to see how we can shape the future of the eco sessions. Are there any members working in private facilities online? Members in the private facility? If you're in the private facilities, please put your hands up. Thank you for attending the eco session. I have a question for you people in the private facilities. What incentives have you done within your private facilities to ensure, yes, Alan Mujeni, to ensure that you maintain these eco sessions being run? We are seeing high numbers of participants coming in from private facilities. I want to know what your experience is, how you've been able to incorporate your eco sessions within your private facilities. So Alan, we're going to unmute you and we hear from you. Alan, you can unmute.
Hello, can you hear me?
Yes, we can.
Yeah, thank
Where
you
do
very
you
much
work?
for the. Yeah, I'm called Dr. Alan Mujeni. I work at St. Francis Hospital, Mutorere.
Okay.
Yeah, as a medical officer. Yeah. Private practice as a medical officer requires continuous professional development as we face clients that are educated. They usually come when they have a clue about their illnesses. Some of them have Googled here and there. And so it requires us to be updated every day about the conditions they are facing. So in the management, we tend to discuss a lot with them. That has been my experience majorly. I don't know how it is in government, but most of the clients in government, for the time I was there, they didn't have an option as they didn't know what was being managed. All they wanted is to be okay and go home. Yeah, so how I've been able to keep up with attending the session, I try to make sure that I begin my work early on a Friday, then spare the time from 2 to 4 for the meeting. I've always tried to encourage my colleagues to attend by calling them to join with me. But unfortunately, at my site, we are not very many MOs. So whenever one is free, the other one is fixed doing work. But yeah, it is quite challenging to find it to attend every Friday because of the working hours. Yeah, thank you.
Thank you, Alan. Is there any member online working at any other private facility? Have you been getting support from your facility to ensure that the eco sessions are incorporated within your continuous professional development programs? Has an incentive been done at your facilities to make sure that the eco sessions are incorporated in your training? Is there any other hand up? Or any comments about private facilities? Okay.
Can I speak?
Yes, please.
Thank you. I'm called Odo Stephen, and then I work in one of the private hospital in Kololo. It is favorable for me, though on other participant side, I see for them it's not favorable, since for me I only work night shift, so I get the time. And then another thing is passion. And then the topic they always give forward for the participants. Like if I'm to see right now, people who have attended to this one is about only 84. And then if you bring a topic that is interesting, people attend in numbers. So basically, the topic they bring determines the number of participants. And then another thing is for the CPDs, I think most nurses are affected, because if I log into my portal, I may not see any point being added yet. I think the EMS session CPD is about 2 per session. So you'll find that up to now, my CPD points is not reflected in my system if I log into that. So maybe other profession like the MOs, maybe they are good on that, but for nurses side, nurses don't have CPD points uploaded in their profile. Let me say like that. Thank you.
Thank you, Stephen. Just to take note, Stephen has been one of our highest attendees for the eco session. So Stephen, well done to you. We can see there is a reflection in the passion that you talked about. It takes personal incentive to make sure that you keep attending these eco sessions. I'm going to hand over back to Geoffrey to continue with the rest of the presentation. So members, let's listen to the presentations made by Geoffrey, and then we shall come back and reflect.
Right, thank you, Dr. Dorin. Colleagues, we can now proceed through our session, through our presentation. So with this slide, we are seeing our most and least attended sessions over the last 5 years. Of course, in 2021, we just had one session, which was the ABCD approach and foundational principles to emergency care. And we had 169 participants. So when it came to 2022, our most attended had 445 participants. That's ECG, the life-saving investigation and emergency setting. So in the same year, our list attendance was 113. And I don't know, maybe it's whether it was because this was a wrap-up of the previous session that was done in 2021. Maybe could be that participants were less interested to attend. But yeah, you can see that the topic is almost closed. Then in 2023, our highest attendance was 508 for this session of blunt and penetrating chest trauma. Then the list was 144. Then in 2024, it was severe malaria in adults with 489. That was the highest attendance. And the list was 204. Then in 2025, this was overwhelming. We had 921. We had 2 sessions that were too close, 921 and 920. One was approach to the convulsing patient, and the other was IPC training on healthcare workers. And the list was 331. So 2026 so far, our highest session had 903 unique participants. These are unique participants. And then the list so far is 588. So what we see from these 2 comparisons is that over the last 5 years, we have an increase in the attendance, or of course, by the fact that even the list attended, there is also an increase. Imagine from 113, 144, increasing to 204. And as of now, our list attendance is 588. So I've tried to share the new attendances in eco sessions for over the last for over the last 12 months. And you can see that there is really a very high increase in the attendance over the months, despite the fact that we're only conducting 2 sessions only for every month. And on average, we have 602 for the last 12 months. We have an average attendance of 602, with almost half, 294, as new attendances. So this is also something that is good, positive, and also I think something to highlight, that if we can at least have more than half or close to a half of the attendees being new participants, it shows the level of scope that we are reaching out to across the country and across the world. Same when I try to compare the individual attendances just for maybe the last 24 eco sessions, you can see that yes, almost half still is being new attendees for this eco session. Of course, the green line is showing the total, and the blue bar is showing the new attendances. And this is for the period of April 2025 up to March 2026. So these are the last 24 eco sessions that have been conducted over the last 12 months. Something to note here is that our reach of the participants from across the globe, of course, predominantly close to 90% are Ugandans, but also to appreciate that over the last 5 years, we have had a very wide geographical reach of our participants. Since 2021, we have had participants from a number of countries. Of course, in the first eco session, we had at least 3 from Kenya. And that ideally means the rest were Ugandans. But then you can see that over the next years, we have had participants from Kenya, from Ghana, Somalia. So I've been able to select the top 20. But overall, we have participants from over 50 countries that have been able to attend our eco sessions. Maybe just one more slide. In country in Uganda, you can see that we have a wider reach from Kampala, that's taking almost 30%. Then Wakiso, Mbarara, and Mbarale, and these are the top 14. So I've been able to add some unique county here. That's Nairobi. It's we have more attendance for participants from Nairobi. It's coming out as number 12 as compared to the other districts within the country. So these are top 40, but you can see the list is 15 just because we have included Nairobi, that is showing a very high participation rate as compared to our country, our districts within Uganda. So back to Dr. Dere.
Thank you, Geoffrey, for those numbers. I want us to reflect on the topics, highly attended topics and least attended topics. Our colleagues online, I want to hear from you. What have been your most enjoyable eco topics that you've attended to date? If you can just post in the comment section from your experience, what were some of the most enjoyable eco sessions that you attended? Were they on pediatric trauma, pediatric medical emergencies? Were they on adult trauma, adult medical emergencies? Were they on obstetric emergencies? Please put in the comment sections and let us know. And maybe you could just give us a quick brief on why that particular topic was very enjoyable to you. In the meantime, I want to find out if we have any members from out of the country on the call. Anyone from Kenya, from Lesotho, anyone from out of Africa? Do we have any members from Somalia, from Tanzania? Please put up your hand. Okay, members, as Susan tells us that the trauma topics were very interesting. Okay. Any other comments? Which topics did you find enjoyable and interesting? Were they pediatric trauma, pediatric medical emergencies, adult trauma, adult medical emergencies? Okay. And then again, I'm asking, do you have any colleagues from out of the country? Any Kenyans? Anyone from Sudan? Anyone from Rwanda? Edward Chu joining from Germany. Wonderful. Edward, could you please unmute? Edward, we want to hear from you. We want to hear how did you find out about the eco sessions and what makes you log on to the eco sessions? Edward is joining from Germany.
Hello.
Hello, Edward. How are you?
Can you hear me? Sorry, I'm trying to navigate from the chat back to to turn on my my connections. So I heard about this session through a WhatsApp group, the Emergency Medicine Empowerment WhatsApp group, and very interested in this topic. I work with Doctors Without Borders, so we are working with colleagues in many many countries, including in East Africa. So it's really wonderful to see these discussions and these efforts.
Okay.
Thank you.
Thank you, Edward. Edward, which of the eco sessions did you find enjoyable and interesting? If you could give us feedback.
This is my first one joining.
This is your first one. Oh. Yes. So Edward, this eco session is different because we are reflecting on the eco sessions that we've been doing over the past 5 years. And we want to have a chance where we can interact with our participants. We want to know how we can improve our eco sessions. So this is not a teaching session. This session is more of a feedback session. So Edward, thank you for joining from Germany. It's glad to hear from you. Do you have any other colleagues from any other country? Sudan, Ethiopia, Tanzania, Rwanda? So maybe we can go back to the chats. Maybe, Angel, you could tell us responses from the chats about the most interesting topics.
I think for most interesting topics, we have Bernard saying the simulations. Sarah Namutebi mentions trauma topics were interesting. Then Jackson Butagwa, trauma and emergency care. The penetrating wounds and trauma generally requires urgent responses, which when done right, save many lives. And gun violence, which is soon increasing in developing countries, requires preparation and effective medical care. We also had a previous comment in regards to how do we improve in regards to attendance, especially for the specialists. As Suman Kamis mentioned that it's attractive to have the specialists by letting them maybe say the specific associations to which they belong, host a topic once in a while. One of us mentioned, I think it was one of our people mentioned that the nurses, the CPD points. Okay, so in regards to the Nursing Council, they had not yet updated the portal for the Nursing Council where we could directly upload the CPD points. So when we reached out to the Nursing Council, they had requested that in our booklets, which we usually write and sign for CPD points, you include the section and the topic that had been taught for that CPD, for that session, and then you would get the CPD points for now. However, the Nursing Council has launched its portal this year, so we're going to see if we're going to be able to upload on your portals directly in this year, but we shall be communicating in due course.
Okay, yes. Thank you, Angel. So it seems people are enjoying the trauma topics a lot over the past years. We all know that the burden of trauma is high in the country. So we want to hear from you. What should we do moving forward? Which topics do you want us to repeat? Where do you want us to focus our sessions on? What emergencies are you seeing at your facilities that you feel you need more training on? where do you feel that ECHO Secretariat can put their emphasis on? Should we focus on adult trauma? Should we focus on adult medical emergencies? Should we focus on pediatric trauma? Should we focus on pediatric emergencies? Should we focus on more simulation type based scenarios? Should we focus on pre-hospital? Should we focus on disaster medicine? We're now moving forward. We want to take you to the next phase of the ECHO sessions and want to make sure that we are attending to your needs as our participants. So if you can just put in the chat, I'm going to pick out some people who I know based on their area of expertise. Chom Hendo says we should focus on medical emergencies. Michael Court, medical emergencies. Okay. We're seeing a lot of medical emergencies, adult trauma, Stephen, pediatric emergencies. Okay. Someone put, this is Chom Hendo, she added hypertensive emergencies, diabetic ketoacidosis. So those are medical emergencies, okay? Sexually transmitted infections. So it seems like we're getting a lot of feedback on medical emergencies and more simulation-based sessions. Yes, obstetric emergencies as well, medical emergencies, and more scenario-based simulation type cases. Okay, this is quite interesting. Victor says we rarely see sessions with surgery. So maybe surgical emergencies, perhaps, yeah? Okay. So it seems we've enjoyed the trauma emergencies, and now it seems for the participants that have been able to comment, you want us to focus more on medical emergencies. There's a bit of pediatric and obstetric emergencies coming in as well. Yes, medical emergencies, NCDs, yes. Thank you, Stephen. Victor talks about burns, acute abdomen. Okay. Okay. I want to hear from someone in the pre-hospital care space. I see Andrew Okiroro on the call. Andrew, if you could please unmute. You're going to be representing the pre-hospital care providers. Which pre-hospital care topics would you want us to focus on? Andrew Okiror, I'm going to ask you to unmute so that we can hear from you. I know you work in the pre-hospital care space. Yes, Andrew.
Everyone, apologies, I'm on the way, I'm traveling. Network has not been quite good. I think for pre-hospital care, really, it might be hard for me to say let's focus on this and this and this, but maybe what I could suggest is we could also look at if there is any recent publications on the burden of emergency care in the country. That could perhaps also guide us on which areas to focus, because then if I would be given the opportunity to choose, of course I would love to say let's also focus on, why are we focusing on medical emergency, what and so on. Let's also focus on pre-hospital care. Of course I would love to focus in my area. So if there is such literature, it would also be a good area to look out for. Then we know. Of course, for example, I know trauma is in pre-hospital, we have a lot of trauma. But again, most times you'd find from the experience of our response, most times by the time you arrive at the scene, you'll find the patients have already either been taken or it's too late. So if we could look out for if there's any publication or documentation somewhere. Like I saw recently in the policy, there was an aspect of the burden of emergencies, which if it has changed, I don't know. We could also base on that to decide on which areas to which topics to generate or populate topics. Thank you.
Okay. Thank you, Andrew. Are there any of our colleagues who are working in remote sites? Those who are working in disaster type settings? Anyone on a remote site? Dr. Asuman, are you at a remote site?
Yes,
Dr. Asuman, I'd like to hear from you.
Yes, Dr. Joy, thank you. Good evening, everyone. Sorry, good afternoon. Currently, I'm not in the remote site, but of course, I chip in once in a while. But basically, in the remote areas, especially in the area I'm associated with, we mostly deal with injuries and also mild medical. We're not too much really into like those bad emergencies because of the preparations, the teachings we give to the workers and everything. They make sure that at least they are safe. So it's mostly safety encouragement in our end.
Okay. Thank you, Asuman. Dr. Alpha? Dr. Alpha works in Arua Regional Referral Hospital. Would like to hear from you as well. Dr. Anguzu?
Yes, I beg your pardon.
Dr. Anguzu, nice to hear from you. How is Arua?
Arua is okay.
Yes, we want to hear from you from Arua. What topics do you think we should focus on moving forward as we scale up the eco sessions? What topics, what cases do you see a lot at the Regional Referral Hospital that you feel the Eco Secretariat can support?
Oh, okay. So I think medically wise, the best would be the CVA. We have been having a lot of CVA cases, ischemic hemorrhagic strokes. Then I think on the side of surgical, mostly it's the head injuries that are severe TBIs. Thank you.
Thank you. Also, from the data that Geoffrey was able to project, there was a high number of attendance when it came to topics related to cardiac arrest. And especially over the last 2 years, we've had some topics whereby we are teaching you advanced cardiac life support, maybe pediatric life support. And I know that people get very excited when it comes to resuscitation of patients. And we want to make sure that we are able to give you the right sort of information. So maybe we can also bring that up again in the next sessions, more sessions in regards to cardiac arrest. Like Dr. Anguzi has talked about cardiovascular accidents, medical emergencies, because these now progress. If someone gets a thrombus, then the person can then arrest. So maybe we could do buildable cases, buildable scenarios that eventually lead to cardiac arrest. So, Dr. Sarah. Dr. Sarah is an emergency medicine physician. She's working in Yumbe. Sarah, I want to hear from you. How is Yumbe? And we want to find out from your experience in Yumbe, what topics should the EMS Eco Secretariat focus on to support you in Yumbe in your training so that you can build capacity back in your emergency department? Dr. Sarah, please unmute.
Thank you so much, Dr. Doreen, and all protocol observed. For me, as far as the clients or the cases that I see in Yumbe, it's a mixed multitude, but mostly medical cases. I also have a lot of trauma. The challenge is I think I'm dealing with people who may not be interested in learning, because these sessions are usually there, but you may be surprised if I have any of my colleagues on call. And that doesn't settle well with me, because it means that every time I'm seeing a patient, I'm literally teaching, which is not really nice. But I think medical cases and trauma would be good for me. Thank you.
Okay. Dr. Sarah, thank you very much. Dr. Sarah is the head of the emergency medicine department at Yumbe Hospital. We shall have a session to see how we can scale into the regions and see how we can support you in the different regions. So we shall have that discussion later on. I'm going to hand over back to Geoffrey to take us through more slides to give us the numbers. So Geoffrey, over to you.
Yes, thanks, Dr. Doring. As we are discussing about those topics that we may be interested in to learn, I've been very intentional to project the attendances over the last sessions that was conducted since 2022 up to date. For colleagues to pick more insights, maybe to propose those sessions that they may be interested to attend. Yeah, I think colleagues have not been able to share much information around that. So I'll proceed to so the next slide here, I was just to emphasize that 61% of our attendees are coming from 14 districts in country. So ideally across the entire country of 146 districts, you can see that over 50% these attendees are coming from 14 districts. Yeah, but the next slide now is just to appreciate the colleagues that have been attending these sessions over time. For example, in 2022, we conducted 21 sessions. And of these 21 sessions, we have a colleague, is Dr. Chizeyo Richard, and he attended 15 out of the 21 sessions. The top 15, you can see that at least they attended close to half, more than 10 sessions out of the 21 sessions. And predominantly, in fact, all of them are from Uganda. But predominantly, you can see that there can work those that are coming from Center 3s, regional referral hospitals, Center 4s, general hospitals, among others. Of course, when we move to the next year, which was 2023, we conducted 25 sessions. And out of these 25 sessions, we have colleagues that attended 20 out of 25. So ideally, they only missed 5. And you can see that one of the colleagues, for example, Rachel Mugerwa, she had attended the very first session in 2021. She also attended 9 out of the 21 sessions we had in 2022. Then the following year, she also attended 20 of the sessions that were conducted in 2025. In 2023. And you can see that still, predominantly, most of these are coming, they are Ugandans. We have MOs, clinical officers. But then also to emphasize that we have a good batch from Center 3s. We can see there are 3 participants from Center 3s that attended. Then regional referral hospitals and private clinics. Then in 2024 still, we conducted 23 sessions in 2024. And we have a colleague, Peter Erema. He attended 23 out of the 23 sessions. So just missed 1 session. And of course, we also have other colleagues that attended a good count of these sessions. Maybe also to do a deep analysis that Peter started joining these sessions in 2023. So I think from 2023, he must have picked interest to continue attending these sessions. And you can see in 2024, I almost attended all, because I attended 22 out of 23 sessions. So ideally, I missed only 1. And yes, all these are Ugandans. Then in 2025, we conducted 30 sessions. These were really very many. 30 sessions. And of course, we have a colleague, Stephen Odoch. who is on the call, and also he has just presented a few minutes back. So of the 30 sessions, he was able to attend 28. So ideally I missed 2. Of course, we have Chandia Ismail, Nabatanzi, Mary, Muima, James Peter, among others. But you can see that something to note here is that the highest parties attendance in 2025 had not attended any previous session from 2021, 2022, 2023, and 2024. However, when they started attending these sessions, I think they really picked very much interest to continue attending all the sessions. And you can see that they hardly missed any session. So they only missed just a few sessions. Of course, we can see that this is really a big challenge, whereby most people that are attending these sessions, they are not re-attending. We have a very big percentage of health workers that are attending these sessions, but the frequency of attending, as we're going to be seeing in the next slides, is not that very much, but very big appreciation to the teams. For example, Stephen, Ismail, and Mary, that are really very consistent in attending these sessions. So overall, from 2021 up to 2026, we have conducted 105 sessions. Just like I said earlier, we had 113, and data for 8 sessions was missing. So of the 105, we have a colleague who has attended 56 sessions, Mukasa Pius Murumba, and this is an MO from Soroti, works at Health Center 4. Then we also have Joel, is a medical officer from Uganda. I think he's at the regional hospital. We have Simon. So the challenge with Joel Ote, I think, I don't know, over the last 1 year, he has not been attending. So he last attended in 2024. So we don't know if he changed an email. That could be possible if he has changed an email, because our unique identifier here is the use of an email. It could be possible that he's attending, that maybe has just switched his email to some other email. So the count there might be raised, or we cannot able to identify this person. But then we have Okelo. We have still Muima. She has attended 40 sessions. We have Tony, we have Albert, and the others. We have Caroline, we have Dr. Chizeyo. But something to highlight here is that some of these participants, for example, over the last 1 year, they have not been attending. It could be possible that they may have switched their emails. Otherwise, we may need to have reasons as to why maybe colleagues are not really re-attending these sessions frequently. Because otherwise, out of the 105, we have only one person who is attending at least more than 50%. Something maybe we can discuss here. And this is a summary now, that out of the 105 sessions, we only have one person who has attended about 50%. Then we have 3 people that have attended at least 41 to 50 sessions. And predominantly, they have attended between 1 to 10 sessions, which is around 96%. So we are very intentional to analyze or see how our attendance has been over the last 24 sessions still, from April last year to March. And you can see that we have 2 colleagues that have attended at least 23 out of the 24 sessions that we have conducted, the last 24 sessions. And of course, the numbers keep reducing up to 1 session. We have 5,309 participants or health workers that have just attended 1 session. And in summary, you can see that 71 have attended at least 12 sessions. So 12 out of 24, it makes a percentage of 50%. So still on the same, what colleagues will appreciate this map on how we have progressed over the last 3 years. You can see that from this map, in the period of 2024, ideally from April to March 2025, it's also comparing the period of April 2025 to March 2026, all up to date. So following our key here, this color here, which is close to yellow, it shows 0 participants. Then the purple shows 1 participant from every district. And then 2 to 5, it's almost white, and it keeps thickening up to above 100. So in this map here, you can see that, of course, yes, by 2024, we had reached every district within Uganda. So that's why you cannot see any yellow. You cannot see any yellow here. And we had only 1, 2, 3, 4, 5, 6 districts that had only one participant by March 2025. However, over the last 12 months, you can see that we have had an increase in the people that are attending our sessions, and you can hardly see any purple in this latest map here. So what does this mean? It means that our scope or our reach has increased. Of course, you can see that also it has become more dark. For example, from here, you can see this is Kampala, Wakiso, but then when it comes here, there is also an addition of Mukono plus Ruwero. Same when it comes maybe to West Nile, you can see, yes, this is Arua, but then you can see that Moya and Ajubani have also come through with very big attendances. Same when it comes to West Nile, this should be Mbale, and then this is Soroti, then this is Lira, this is Gulu. I'm highlighting districts that really have above 100 participants that are coming through our concessions. Then this should be Masaka and the others. So you can see that there is a positive trend comparing the two time periods over the last 24 months. And I should say maybe this is something that we can be very intentional about. How can we reach out to the other districts that are maybe lagging behind to ensure that maybe we can have really this color of dark blue. Back to you, Dr. Doran.
Thank you, Geoffrey. Thank you for that amazing presentation, and you've given us an illustration of how the members are scattered across the country. So to colleagues online, we want to discuss with you on how we can increase our presence in the different regions. Majority of our participants are within the central region. We seem not to have many participants in the regional referrals, especially areas in the north, areas also in the east. We want to hear from you on any suggestions on how we can perhaps regionalize these EMS eco sessions. How can we increase visibility, or how do you think we can support you at the regions to make sure that you have a bigger number? For example, what Dr. Sarah was saying in Yumbe, that she's struggling with getting people in her hospital to attend these eco sessions. So for us to be able to address this problem, we need to find local solutions that are going to work for us. So I want to hear from you at the regions. Maybe I can start off with anyone who's working, coming from any regions in the east, any districts in the east. Anyone working in any districts in the east, please put up your hand. Dr. Mulumba, you are on the call. Yes, Dr. Pius Mulumba, I know you're working in Soroti. Well done on having one of the highest attending, actually the highest. You're the highest participant in this eco session. So well done to you. We want to hear
Thank you
from
very
you.
much.
We want to hear from you. Are you the only person at your facility that attends these eco sessions? And if not, how have you been able to encourage other people to join you in these eco sessions?
Thank you very much. I'm not at my, well, I have several locations in my area. And in my case, I'm a bit lucky because working with the police, it's a system that is command-based. When you issue one instruction, many times people follow through. Obviously, lately it's been a bit tricky because our area is expanding, because we were given some more facilities around the Katakwi area where we're having a training school. With the political season, we had a lot of trainings and I had to keep moving quite a bit to supervise that activity. But in my end, it is mostly trauma, natural again, because of the nature of work and the kind of season we have been in. We've had a lot of trauma cases. And we are privileged, yes, of course, that at least our teams are easy to guide. You instruct them, you give them priorities and targets, it's easy for them to follow through. But if ECHO and the ministry really, because especially on the
Karamoja end, we are getting a lot of support in terms of the IT equipment. They're supplying tabs, they're supplying computers, establishing internet connectivity. So it is a lot harder to make excuses if the ministry has even given you the computers and the internet connection to do the work. It's just about getting people according to the program of the eco sessions. People follow through with this. So the attendance, well, it would be really higher, but the duties, the nature of duties and the unpredictable season we've just come out of has had a bit of an impact on our attendance, but we are trying to keep it up. Thank you very much.
Thank you, Dr. Mukasa. Anyone else from the regions? From the Eastern region? Maximilian from Katakwi. You're also one of our highest attendees. Maximilian Maxima, I believe. Yes. Muima. Maximilian Muima. Please unmute and tell us how you've been able to encourage your colleagues to join these eco sessions.
Hello, I hope I'm loud and clear.
We can hear you loud and clear.
Well, I'm called Muima Maximilian. I also work with the police, and the previous speaker, Dr. Mukasa Pius Mulumba, is my boss. Like he has already, when he issues instruction that all of you attend this session, you have to attend. So that's how we have been able to make it.
So, Dr. Mukasa, thank you so much for putting out an order. Please keep it up. Do we have anyone else from the region?
Apologize if it sounds harsh, but sometimes the initial force helps to get a bit of momentum before things get easier. But we shall keep trying. Thank you very much.
Thank you. Anyone else from the Eastern region? Anyone from the Northern region apart from Dr. Sarah, who had spoken earlier? We had talked to Dr. Anguzu from Arua. Anyone from Lacho, from Gulu? Would want to hear from you. We hear a lot from people in the Central region and Wakiso. George Michael, you don't work in police, okay. Okay, so anyone from the Western region? Anyone from Western region? Please unmute and tell us how you've been able to motivate your team. Again, this session is we want to have times to reflect. We want to see how we can improve our eco sessions. So your feedback is very important to us. We want to make sure that we scale it up and we improve it. We also want to open up discussions with members from the different regions to see how we can have the eco sessions being run by some of you at the region. We want to see if we can take the eco session out of this room and out of the Central region. And say, for example, we take it to Yumbe, let Yumbe be the one to host the eco session. There's someone from Tororo, that's Edna Christine Opio. She says her network is a challenge, but she's on the move. We totally understand. Anyone from Bara, anyone from Mubende region, anyone from Fort Portal, anyone from Hoima, please unmute and tell us how you've been able to have your colleagues join the call, join the eco sessions, how you've been able to encourage people to participate on these eco sessions. Do we have Muhumuza Charles on the call? Do we have Albert Owor on the call? Okay.
Caroline Kebirunji.
Caroline Kebirunji. Please unmute and tell us where you're working and how you've been able to have people join you on these echo sessions. Caroline Kebirunji, you've also been attending these echo sessions. We want to hear from you.
Hello, good afternoon.
Good afternoon, Caroline.
Sorry, I may not be able to say much because I'm on the move. I've been joining this session since 2023, initially from Islamabad, and then again, I think from 2025, started joining from Rukunyi General Hospital. My colleagues did not know about these echo sessions. However, when I started putting one on when we're in theater, I think some of my colleagues got interested and they could join in, and they were really interested. Up to now, I still try to call on them, and sometimes they join in with me. Thank you, and we hope to learn more from these sessions.
So some of you have already demonstrated yourselves as echo champions in your facilities. I will not say names, but you know who you are. We want to thank you so much for being champions where you are. You're carrying the torch for these EMS echo sessions. Some of you have made directives and orders to ensure that echo sessions are attended by your colleagues. Some of you put these echo sessions in places and you display them with your phones on your laptops. We thank you so much, and we want to see how we can support you, our champions, because at the end of the day, if we're able to train people around us in the practice that we do, we need teamwork. And if you're the only person in your team who's trained, then your work becomes a bit more complicated. But also it doesn't improve the patient's outcomes. And at the end of the day, we do these echo sessions because we want to improve patient care. We want to reduce mortality, we want to reduce morbidity. We want to improve the emergency response. Mahmoud Stephen, your hand is up. Let's hear from you. Tell us where you're working and how you've been able to encourage your colleagues to join the AMS echo sessions.
Yes, good afternoon. And this is Jalimpa Comfort. We are sharing the gadget with Mahmoud Stephen. And we are speaking from Gul Military Hospital. And
speaking from where,
Mahmoud has been, yes, Mahmoud is coming from Gul Military Hospital, and we are sharing the gadget. Right now we are 3.
Okay, greetings.
And he's our coordinator for, yeah.
Okay, so you work at the military hospital?
Too. So Mahmoud is our, yes. We are in the Gulu Military Hospital, or 4th Day Military Hospital.
Okay. All right.
Am I audible enough?
We can hear you loud and clear.
Yes. So to me, my concern was because I'm looking at the level of organization and the series of CMEs that have been going on. I'm tempted to miss out on these CMEs. Only that we need to work out how we can increase our visibility and the notification for these CMEs. Since it comes once in a month, it's very easy for someone to forget about it. So the moment we can increase it, because I don't know, because Mahmoud was telling us you have to get to Twitter. And there are so many people who are not on Twitter. Even there are other WhatsApp groups where they are not, there are other programs, like where we get, for me, where I get the link, there are other programs. So it is very easy again to miss it out. So we just need to work out on how best we can increase on the notifications, timely notifications, and we ensure that people get to know it in time.
Okay. Thank you.
Maybe email could work better. I was thinking maybe if we could send email as in form of reminders whenever it is approaching maybe 1 week towards the CME. Otherwise, I love the organization and I appreciate all the expertise to ensure that we improve our services that we give to our patients. Thank you so much.
All right. Good to hear from you. Yes, over to Angel to read some of the comments.
So we have a response from Brenda Nampuma, who says, how to ensure different cadres attend. We encourage multidisciplinary case sessions, rotation of leads. So let the different cadres lead a session or segment each week. Then you might be missing out. Samuel Subuga says you might be missing out many health workers because majority don't know what the EMS Eco Initiative is. So I think the call goes to all old participants to share every session link to their several platforms so that teams get to know in time, and that is how you also go to log in. So I think also just like Mahmoud has mentioned is usually if you register for the EMS Eco Session, we have your email captured and we usually give updates when we have the Eco Sessions. So just like Samuel Subuga has suggested, when we share across our different platforms and people are able to register, then we are able to send them live notifications to join these calls and these sessions. So let's share wide and about on our different platforms, on our WhatsApp groups, like that. Then Stephen Ododge says that I believe the turn-up will be great with majority from government health facilities with the app here, which requires internet, and everyone will have access to internet and to attend. So inviting other participants to attend upcoming sessions is more important by forwarding them from an EMS Eco WhatsApp group to others, but I also request the WhatsApp channel be created. So maybe we shall try to come up with that one. Okay. Then I think some colleagues also share gadgets during sessions, meaning the numbers could be higher than what is actually recorded. I think I've just seen from Mahmoud, there are 3 of them sharing one gadget. So I think that can also be a valid point as well. Then anything else? Yeah. Anyone else have any additions?
Okay. All right, thank you, Angel. We're going to hand over to Geoffrey to close and give us the way forward for this eco session.
All right, thanks, Dr. Doreen. Yeah, so this is our very last slide about our next steps following the discussions of what we have had, and also following the different eco sessions that we have been having over the last 5 years. Of course, one, just to say that the eco sessions are going to continue, and maybe to clarify that these sessions are happening bi-weekly. So they happen twice in a month. So let's be very intentional to maybe check our emails. I know the teams are already sending out emails to the different participants that have attended before. But to be very intentional that they happen twice every month. So we intend to conduct an impact assessment. This will be targeting sites with regular attendees. For example, we already identified participants that have been attending over time and have been attending a number of sessions. Then the other is to identify eco champions. And this will be identified from those sites that are still having these very regular attendees. And this will then follow a decentralization of our trainings to different regions that will be acting as our training hubs. And of course, this will start on a small scale as a pilot to see how the attendance is going to be, and maybe the feedback that is going to be coming out of these sessions that will be decentralized to different regions. Yeah, back to you, Dr. Doreen.
Okay, thank you, Geoffrey. Geoffrey has been able to summarize 5 years in 24 slides. So thank you so much for that. So colleagues, what next? How do we move on from here? Over the last 5 years, we've covered so many topics. we've done adult emergencies, we've done pediatric emergencies, we've done pre-hospital, we've done disaster medicine. We've had topics when it was the Ebola outbreak. We've had topics when it was the COVID-19 pandemic as well. So what next for us here? How do we move on? How do we improve these echo sessions? Like I said, first of all, we need to make sure that we are able to identify your needs, because we need to give you the information that you need. These echo sessions are not designed for one cadre only. They're not designed for doctors. They're not designed only for nurses. They're not designed only for pre-hospital care providers. They are designed for all clinicians across the different cadres. So we welcome the different cadres on board, and we've tried as much as possible to have these different cadres come in as experts in these sessions. As you've seen over the years, we try and ensure that we have different cadres coming in so that we hear from the different people who are involved in the care of these patients. We've also transitioned and we've made sure that we do not cover only specific adult emergencies. We've had obstetric emergencies, we've had psychiatric emergencies as well. We had a session recently on blast injuries. So we've tried as much as possible to get out of the routine common scenarios that you've seen. Truth be told, common things occur commonly, but also the uncommon things will still occur. So as much as we can, we try and make sure that we give you a wide scope of topics, because these diseases don't read textbooks and these patients do not read textbooks and they do not follow protocols. So they can come in any form. So what we've gathered from this session is, one, we need to have a culture change. We need to find a way to motivate our colleagues, motivate our leaders, motivate the people that we work with, that we train with, so that we can have one voice. The practice of emergency medicine, we do not practice alone. We do not practice in isolation. You need to have a team to support you. So culture change is very important. Find ways, find incentives of encouraging your colleagues to join this echo session. Two, communication is very important. We've taken that feedback, that we'll try as much as possible to increase visibility across the different platforms. We shall get out of Twitter and maybe increase to Facebook as well, increase to Snapchat, increase to TikTok, increase to all the different platforms so that there's no excuse. We can increase to all the different platforms that you want, so that you can increase visibility across the different social media platforms. The other feedback we've gotten that is very important is, it seems you're interested in medical emergencies. So what we shall do as the EMS Eco Secretariat, we shall streamline our sessions and prioritize medical emergencies. The interest has always been trauma, but now we need to focus more on the medical emergencies. Also, there was an interest on cardiac arrest as well, and see if we can bring that up into the different sessions that we are going to have. There was a discussion around creating an EMS Eco champion per region or per facility. And this is helpful for us because these eco sessions are not meant for Kampala alone or for Wakiso or for the Central region. These eco sessions are meant for a wider audience. You see, we had even someone from Germany join the call. We've had people from Somalia, from Sudan. So these eco sessions are meant for any clinician who is working, who is going to be able to manage patients in the emergency setting. And these patients can be anyone, it can be me, it can be you, it can be your loved ones. So we have to make sure that we prepare ourselves to manage these patients. So it's very important that we always get into the habit of making it a routine. There was a comment about the CPD points. Angel was very kind to give a feedback to the nurses about this. Our nurses, we applaud you, we thank you. You've had one of the highest attendings on these eco sessions, and nurses and medical officers. So please continue carrying the torch in the practice of joining these eco sessions. I'm going to hand over to Angel to conclude for us the different comments that she's been receiving so that we can close off this session.
Okay, so we have a last comment from Brenda Namvuma, who says, how to improve visibility in our regions is targeted WhatsApp groups. Instead of one massive group, we can create regional subgroups. Then we can have regional case studies instead of using general case studies. Then the regional champion, just like Dr. Doreen has been talking about, could appoint one committed, respected health worker per region as a visibility champion to remind peers about the sessions and gather feedback on what local topics need to be addressed. So someone was asking about how do we gain access to the CPD. They have shared a link on how to register for the CPD points in the chat. So for those who are interested, please go and register on that platform. So I think basically, thank you so much for the engagement on our chat options. And as the Secretariat on our end, we are going to work hand in hand to try and meet some of these solutions that we have engaged about and discussed on, and see how best to share this knowledge. Just like Dr. Doreen has mentioned, the knowledge, the emergency medicine and emergency care is team effort. So that is why we are encouraging everyone, all cadres to join, because once we are handling an emergency, we need everyone to participate to improve the success rates of our resuscitation or stabilization, and as well to encourage people in other health facilities, not always being in a health center and always planning to refer. So how about we improve also our patient care down at all our facilities that we work at, such that we have better outcomes for our patients. We always look forward to improving patients' outcome. So allow me to thank you all for engaging with us and hand over back to Dr. Doreen, the chair of the session.
Okay, so I'm going to have, we've had from you, members on call. We've had members from Arua, Yumbe, Soroti, Katakwi. We've had from people in the, yes, you have people from the private facilities calling. Thank you so much for being part of this eco journey. Thank you so much for being part of this session. We've gotten all your feedback, and as a representative of the EMS Eco Secretariat here, it is our job to make sure that we deliver to you, and we make sure that we deliver what needs of yours that need to be addressed. I'm going to ask you to put on your videos. This is a tradition for us here at the Eco Session. We need to see you, we need to take our pictures. So please put on your videos, put on smiles. Samson Okumu, Samuel Nsubuga, Brenda Namvuma, Victor, J. Peter, Emmanuel. Please put on your videos. We need to see you. Hilary, we can see you. Okiror, we can see you. Dr. Pius, we see you. Thank you for putting up that directive. Felix, we need to see you. Samuel, we need to see you. We need to take our photo. Drusilla, we don't see you. Felix, Brenda Namvuma, please put on your camera. Okay, so from all of us here at SID Global Health, from the EMS Eco Secretariat, we want to thank you so much for this very interactive session. We shall take your feedback and we shall resume our teaching sessions within the next 1 or 2 weeks. So let's all smile for the camera. The next session is on the 29th And we shall talk about mass gatherings, and this is in preparation for the Mother's Day celebrations. So let's prepare for that session. Otherwise, thank you so much. Have a lovely weekend and God bless you all.
Thank you. Bye-bye.
Bye. Bye.